Greetings, everyone, and thank you so much for joining us this evening. My name is Harold Flanoy. I am the president of the Gamma Eta Lambda chapter of Alpha Phi Alpha Fraternity Incorporated, located here in Austin, Texas. We are so excited on this night for you to join us for this virtual COVID-19 town hall. This year, the Gamma Eta Lambda chapter of Alpha Phi Alpha is celebrating our 75th year in existence. And in doing that, we have decided to put on events this entire year in celebration. And at this time, because of all that's going on with COVID-19, with all of the needs that we have as a society and as individuals, we desire to push out more information for individuals like yourselves that are listening on this night to better understand how to deal with this ravaging disease. We have experts that you're going to hear from on this night and even next week when we come back for round 2 of this event. I want you to know that in celebration again of our 75 years, this event is only going to be 75 minutes long. So we've prepped everyone to know that it is going to be quick, it is going to be thought-provoking, and it's going to be something that you can grab and listen to and better understand what's going on in society today with COVID-19. At this point in time, I'm going to bring on my brother, Brother Charles Deshay, who is actually going to lead us as the moderator on this night. So I'm asking for everybody to sit back and relax and prepare to hear from Brother Deshay as he prepares then not only to help moderate this endeavor, moderate this event, but then also get questions out to all of those that are listening, so that way you know more about what is going on. So let me bring on Brother Deshay right now with me.
Good evening.
This evening.
Good evening.
Good. Hopefully you're just as excited as I am to get this event started. This is something not necessarily new for Gamma Eta Lambda in the context of doing events, but this is something new and doing it in this capacity. So I'm excited to be able to help kick this off and to try to help individuals learn more about COVID-19 and know what we're dealing with in this context, because we've been dealing with this for over a year now. And it's time for us to ensure that all of our family, our friends, loved ones that are watching tonight get as much information as possible. So
Indeed.
I'm getting ready to back off and hand this over to you. It looks like all of our guests are here on this night. Specifically, we're going to be bringing up Dr. Mark Escott, and then also Miss Stephanie Hayden Howard, who is with us. And then shortly after that, we'll bring up Mr. Christopher Shorter from Baltimore. So I'll just kind of hand it over to you and allow you to introduce them, which I've kind of, told everybody who's coming, but you can introduce and give a little bit of information about them, and then we'll go from there. So it's in your hands, brother.
All right, thank you very much, Brother President. And again, thank you all for tuning in as we explore the effects of COVID-19 with the Black community. Tonight, we have the pleasure of not only receiving vital knowledge from an esteemed panel of guests, but also to ask those questions many of those people in the Black community have. It is our hope that the information presented tonight will aid you in making important decisions about your health, especially in regard to COVID-19. So without further delay, let's just jump into it. Within the first group here of the first segment tonight, Chief Medical Officer of the City of Austin, Dr. Mark Scott, will be speaking, as well as the Director of Public Health, Austin Public Health, Ms. Stephanie Hayden Howard, as well as the City Administrator of City of Baltimore, Christopher Shorter, who's also a member of Alpha Phi Alpha Fraternity Incorporated. And so let's just jump into it. Dr. Scott, I have my first question to you is, why is the Black and African American people, why is this particular community unequally impacted by COVID-19? Can you give us a insight, please?
I sure can. I can do my best. Can y'all hear me okay?
Yes, we can.
Perfect. Unfortunately, for those of us in public health, this is not a surprise that this would happen. In fact, early on in the pandemic, Director Hayden Howard and Chris Shorter and I had some of these discussions. Where is the impact going to be bad? It's going to be bad in our communities of color. It's going to hit our rural areas harder because that's what always happens. And it always happens because we as a community, we as a state, we as a country have really failed to address those issues that have persisted decades and decades, which is we don't have adequate access to health care. We don't have adequate education available to be able to adequately provide resources and underlying health care to people in communities of color. We have things that are simple and easy to treat, easy to diagnose: diabetes, hypertension, obesity, and it's because we've neglected those things for so long in our community that we are seeing the impact play out in those communities of color. We have no indication that this is a genetic issue that's disproportionately impacting African Americans and Latinx community, but do believe it is related to those underlying healthcare issues, those social determinants of health that impact everything else in healthcare, which leads to higher rates of death from heart disease, from cancer, from strokes, and from other diseases. And it's something we have to continue to address and really, I don't want to say waste, but we need to address the COVID issues, but we cannot leave it there. If we leave it there, if we just take the vaccines and the PPE and that kind of stuff and not use this as a springboard to address those underlying issues, we are missing a major opportunity. Brother Charles, I think you're muted.
Yes, I am. Thank you. Miss Hayden Howard, how would you explain what other barriers exist in the Black communities that are more prevalent and that are impacting this demographic group in regards to COVID-19?
Well, first of all, thank you all for the opportunity to be here this evening. I always am very excited to join in with others and definitely share information from a public health perspective. So thank you. One of the things that really comes to mind, and Dr. Escott, really, I agree with everything he said. We're always needing to also kind of think about the social determinants of health, where you live, work, grow, and play, really starts to can really affect your health outcomes. And so when we are able to overlay the data, and this is true in Travis County, but I encourage you also to do this in your community, where you go back and you look at areas where you have folks that are living that may be living in poverty, where you have pockets of folks that are uninsured. You have folks that may not have access to transportation. You don't have access to fresh fruits and vegetables, etc. You can overlay that with your COVID zip codes, and you're going to find that those are the same areas. And so it's going to be important for us as African Americans that we definitely start to look at how these things are happening and be able to get at the root of how can we make a change? How can we pivot and make changes that are not just for COVID in this environment, but how can we move forward and be able to make those change? And those are lasting changes that we need to carry from this generation to the next and kind of continue it forward.
Thank you very much. Brother Shorter, recently President Biden announced in a fact sheet that 90% of the adult U.S. population will be eligible for vaccination and 90% will have a vaccination site within 5 miles of their home by April 19th, which was yesterday. Give me your insight in regards to that fact sheet that was recently published.
Well, let me say first, brother, it is absolutely amazing to be on the panel with Director Hayden Howard and Dr. Escott. They are a dream team in terms of the leadership that they have provided in the city of Austin and in Travis County in our activation as it relates to COVID-19 and our response, and certainly this recovery and how devastating it has been and how much of a crisis really it has been, not just for the city of Austin and Travis County, but our country and our world. So that said, it is a true honor to be on panel with them again after a few months of being in Baltimore. In terms of vaccinations, so that is certainly where we are in this fight against COVID-19. The vaccination process has exposed, in the same way that COVID-19 exposed health concerns that have been long lying, our vaccination process has exposed concerns around how we get around, how depressed communities and communities where we have under-resourced have had challenges with transportation and getting to these vaccination sites. So I'll say that it is extremely important when we hear that a vaccination site in that other modes, because it's not just vaccination sites. I will tell you, here in Maryland and Baltimore, we are also moving to have mobile vaccination, which is absolutely essential, critical for our senior population and for those who cannot leave their homes or have mobility issues. We are also doing we're doing home visits where possible. So I think that is extremely important when it comes to helping our most vulnerable populations. So the fact sheet comes as good news. I will say that the numbers, although we've had a bit of a dip with the JJ news, our numbers in terms of vaccinations are picking up in an exponential way. I really do hope that we use this evening and other forums like this to spread the word around the safety of the vaccinations and the need, especially within our community, to get vaccinated. I think you are muted again.
Having some technical difficulties over here. You hit it right on the nose, especially within that fact sheet. It talks about how the efforts to get the nation's most vulnerable, as you mentioned, and at-risk seniors and people with disabilities vaccinated. Dr. Scott, we're seeing the COVID-19 numbers increase. What else can be done to stop that potential surge? And it's a two-part question. And does the COVID-19 vaccine, how does it affect, or does it affect rather, demographic groups differently? And these are some of the questions that people in the Black community have.
So again, I think there's a two-part strategy really to really pushing down the burden of disease locally and certainly throughout the U.S. And that is continuing the precautions. Number one, the masking, the distancing, the hand hygiene, staying home when you're sick, getting tested if you have any symptoms. Those are still key and will be key for some time. But the other side of that same coin is really pushing through this vaccine hesitancy. And people are hesitant. It's a brand new vaccine. It's just rolled out. It was produced in record amount of time. That leaves concerns. So I don't see hesitancy as a negative. I see hesitancy as people who want questions answered. And as Chris mentioned, it's sessions like this happening over and over and over again in every forum, every community group, in every church, every school across our community to help us push through that issue, answer the questions, and ensure that folks have the facts when they make their decision about being vaccinated. I will say, I've reviewed all of the submissions to the FDA for the three manufacturers, the three vaccines that have been approved, and they've all gone through rigorous testing. They've all included communities of color, African Americans, Latinx folks, Asian Americans, and others, which is really, in modern science is a requirement for these kind of studies. And looking, each of those studies breaks down the efficacy across demographics, across age groups, and it's excellent. I mean, let me give you some perspective. The best flu vaccination that we have in history is 60% effective. Okay, with one shot of any of the three, you've already exceeded the best ever for flu. When we go to 2 shots of the Pfizer Moderna, you're talking about 90+%. When you're talking about prevention of death from COVID-19, it's almost 100%. And I've got some slides that I could show you if we have time later, but let me just summarize and say the risk of hospitalization at every age group is much higher with the natural disease than with getting a vaccine. Something, going down to people in their 30s, 1 in 66 people is going to end up in the hospital in their 30s from COVID-19. I think we'd hear about it if 1 in 66 people who got vaccinated were hospitalized. It's just not the case. It's extremely rare. I know folks are concerned about the 6 individuals who had these blood clot issues. That's 6 out of 7 million. I think you have better chance of being struck by lightning than having that kind of impact. But with any medication, with any vaccine, it's going to have some risk. That risk is not zero, but it's really about weighing the risk of the vaccine versus the risk of getting the disease itself. And my personal concern is increasing about getting the disease. The more people I know who've got it, the more people I've known who have ended up in the hospital, who are young and healthy, who months later are still having trouble breathing, still having exercise intolerance. I've had family members who have died from COVID-19, and it's time to say enough is enough. I think that, in particular for the African American community, you can't let COVID-19 beat you, because it will. It will decimate the African American community if we don't take control, if we don't get the word out, if we don't get vaccines in arms. It is a killer, and it kills African Americans more effectively than any other race or ethnicity in our community. The risk of death for an African American is 2.5 times that of Latinx members of the community and white non-Hispanic members of the community. It is devastating, and we've got to do something about that.
That's definitely concerning. I have to pause there. Receiving that information, Ms. Hayden Howard, after hearing that from Dr. Scott, I mean, there's been some observations that in some urban communities, which individuals that don't live there are actually traveling there to get vaccinated, and they're showing up. I know initially when the vaccination was rolled out, there was an issue sometimes with so many people going to the website trying to get a spot to get vaccinated. But how can we preserve, or how can we regulate those type of communities who live in effective, diverse Black communities, undeserving? How can we protect, in a sense, regulate, and allow them to really receive this vaccination in all those spots? And it's a 2-part question for you. That's my first question for you.
Austin Public Health it's what's called a hub operator, and the Texas Department of Health Services, they designate entities that are able to provide vaccines out to a large number of folks in a short amount of time. And so we were provided a weekly allocation of 1,200 vaccines a week. However, the agreement was, in order to continue to receive 12,000 vaccines a week, we had to be able to get the vaccines out as quickly as possible established appointments have a platform that is used for anyone across the state of Texas. And so definitely a balance for us. But one of the things that we did early on is that we created an equity process where grassroots organizations have been able to, and including faith-based organizations, have been able to refer folks into us that may not have access to the internet, unable to, initially book appointments and get into those slots. And so we've been able to have folks to come in that way, where we schedule them through our equity line with those outbound calls after receiving those referrals. The other thing that is really key that works so well is smaller sites have been working very well. We have a site, for example, out in Pflugerville, Texas, and then we also have another site in South Austin, in the Dove Springs community. And so those smaller sites, people really like those more because they are neighborhood sites and they are near where an individual, can access them. In addition to that, the other thing that has been important is that we have partnered with the faith-based community. And in earlier this month, we partnered with the Black Physician Association, and Dr. Tina Ward. She is totally awesome. She says, Stephanie, I will recruit you Black physicians to come and assist you with this faith-based ministry. And so basically, she was able to get the physicians. We worked with the churches. And so we actually had over 800 people scheduled, but it was a drive-through and it was rain. And so some people didn't come, but we were still able to do almost 600 vaccines on that Saturday. And so we're planning to re-up and do that again, to provide the second vaccines to the ones that came to that event, and then be able to provide some more in May. And so partnering with the faith-based sites and the pastors. And so they are willing to refer folks to us to go into our regular sites, but then they're also have offered us to be at their locations. And so that is key, is that being able to work through those relationships and those partnerships where we are meeting people where they are. Let's just be real. African Americans, at the heart and core of who we are, we go to church. And if we're going to trust someone, we're going to trust our pastor. And so that has been really key and paramount. And so we're definitely going to be doing more of that. And then lastly, we have partnered with the Housing Authority. We've gone out to 4 of those locations, starting with seniors and persons that are disabled that are living in Housing Authority. We've gone out to, we've even partnered with Capital Metro because we know that a significant amount of the drivers are African Americans. We've partnered with Foundation Communities. We're going to do more of the Housing Authorities Meals on Wheels. We've gone out and provide vaccines to folks when they got their meals. We were able to come and provide the vaccine as well. So those partnerships are key.
Okay. Thank you for the information. And you kind of answered my second question to follow up. I was going to ask about the logistics. Do you have any information in regards to logistics, especially, with the issue of Johnson & Johnson vaccine being paused due to the blood clotting issue? So are there any issues that the Black community or just all communities should be aware as far as what's being rolled out from the logistical stance?
I think the important thing when we think about logistics, I think about, one, it's important for us, again, to meet people where they are. Being able to, we have a mobile team that's been going out doing visits at home. We recently, now that everyone is eligible, they're making note of who's in the home that wants the vaccine. Last week, we had a person went out. They provided the vaccine to the mom, 91 years old, but also were able to provide the vaccine for her son that's in his 70s. And so being able to reach multiple people when you think about the logistics. I will tell you, we have received primarily Moderna. We've only received a very little of J&J Janssen vaccine. And so I know a lot of folks say, well, you all have to stop J&J for now. But ironically, we just had not received that much. And so I think for some folks that have been really heavily relying on that, it was a huge pivot for them. But we just kind of continued our operations and just plan to go back and do, 2 vaccines, for homebound folks, or even for our homeless population.
Brother Shorter, it seems like the way to really reach out to the community is really meeting where they are. The mobile clinics, the at-home visits. What are some of the things that are being implemented in the city of Baltimore? And I have a follow-up question for you as well.
Yeah, no, I appreciate that. And I'll say it's very similar. Director Hayden Howard and Dr. Escott have spoken to the very unique ways and strategies that our governments, our local governments that are primarily serving urban cores, that they are employing to reach hard to reach populations. And those hard to reach populations happen to be, in most cases, the most vulnerable. They are the ones who have transportation issues. We have to take into consideration populations with disabilities. And so, like Dr. Escott and Director Hayden Howard mentioned, these smaller vaccination sites that are right in the neighborhood, partnering with smaller organizations that already know these communities, that know where the networks, of vulnerable people in places are. I'll say organizations like Meals on Wheels, there is intelligence there about where our most senior population is, and who needs the support. It's a good question. What I'll say here in Baltimore is a place that has about 7 major hospitals. So our city has a lot of healthcare professionals and other professionals coming into the city every day to work. And even during COVID, they were coming into the city to work. So what that meant is that early on during the vaccination period, what was happening in terms of vaccinations is that many folks who were being vaccinated did not live in the city of Baltimore. So we were seeing sort of non-residents, if you will, vaccinated at out-proportioned rates. And so we had to really work hard to make sure that we were getting an appropriate percentage of vaccinations proportional to the size of our population, given how much we were giving to professionals who did not live in Baltimore. And I'll tell you that the city of Baltimore was much better at partnering with small organizations to get to more vulnerable populations. So it really is an amazing story, and one that is still being told, and I should say still being written, in that we have a lot of work that we've done and a lot of work that we're doing to get to those vulnerable people that need the extra support.
Thank you. A follow-up question to what you have described, what's happening in the city of Baltimore, would be as far as the technology accessibility. It seems that a lot of the technology is being utilized to allow citizens, your people who live in the city of Baltimore or Austinites.
Oh, brother, you went on mute.
Thank you. I keep doing that. Thank you. I was mentioning, thank you for that insight. it seems that the technology is the main medium as far as that's allowing people in the communities to secure these vaccinations, these spots, or to get information. Are you seeing any issues as far as the lack of technology not being prevalent in the Black community?
Yes. What is happening is the populations who are the most educated, who are the most technically savvy, that know how to access what is our state vaccination website, and then get information in. Um, those are often the populations of folks who have the resources and have the know-how to work and manage our system. There is a population, the same population we've been talking about for the last half hour, in some cases that just flat out does not. And so we have to make sure that we don't just rely on technology tools. Our governments have to make sure there are other options and that we are reaching populations out that are not going to access the app, if you will, the state app, to sign up for vaccinations. So oftentimes, I don't know if this is happening in Austin now, but certainly in Baltimore, these smaller vaccination sites, the mobile unit, they are not only taking registrations via app. They are also taking walk-ups. They are also going to places where residents may not have even known that they needed to sign up via app. So we can't just rely, our governments can't just rely on technology and expect that our residents are going to be able to access that technology as other populations may. I hope that answers your question.
It does. Thank you very much. I have a final question for all three of you all. And the question is, with everything going on track with the surges of cases, the variances, should we cancel our travel plans? I know Mother's Day is coming up, but due to the coronavirus, COVID-19, should we actually be traveling at this point in time, or should we just cancel that to be safe?
That's a great question, and one that we're certainly getting a lot as summer approaches. And I'll say, it depends. It depends on your vaccination status. It depends on your risk, whether you fall into one of those high risk categories. And it depends on where you're going. One of the concerns we have, even amongst vaccinated people, is traveling to countries that have a very high level of transmission at the time of the travel. Because as that transmission increases, like what's going on in India right now, for instance, the more aggressively it transmits, the more likely it is that you see variants emerge. And when you interact variants plus vaccinated people, it creates a recipe, an opportunity to create vaccine-resistant variants, which would be very bad for all of us. So I think you need to look at it carefully. The State Department, CDC, is going to be updating their guidance to travel international, and it's going to list 80 countries as high risk, and you should change your plans. But again, that is I think a family's decision, and it's got to be based upon assessing that risk versus the need to travel at that particular time. Domestic travel, I'll say, is we expect is going to be relatively safe as long as precautions are followed during the transportation process and when you're around other people who are not from your household. So, again, a lot of this depends upon how quickly we can get the rest of the community vaccinated and how long we can maintain those protective actions, the masking and distancing, so that we can drive down the disease. My hope is that when May rolls around, we're going to have the ability to vaccinate individuals down to age 12 with the Pfizer vaccine. That EUA modification was filed on April 9th. We haven't seen a definite scheduled time yet, but the expectation is that sometime in May we expect that to be approved by the FDA. So all of a sudden, all the way down to middle school students should have the opportunity to be vaccinated before the beginning of summer. So again, I think if you have a middle schooler or high schooler and you're planning on going on summer vacation, get the vaccine for sure before that. Get the vaccine for sure before summer camp if you can, and certainly before it's time to go back to school in the fall. Again, we've got a long way to go, a lot of ground to cover to get to herd immunity. I wish we were close, but we're not. It's persistence, it's repeating the message, and it's people talking to one another and asking those questions about vaccinations at every opportunity that's going to help us get there.
Ms. Hayden Howard, your thoughts?
Well, he's given a very good comprehensive answer. I think we are seeing more folks decide to drive to their destinations, for various reasons. I know we've seen more people to rent those kind of Winnebago type vehicles to be able to kind of stop along the way and kind of enjoy the route as well as the destination. And so, I totally agree with Dr. Escott. Definitely taking those precautions, but getting those vaccines is definitely going to be key.
Yeah, I'll say, brother, I couldn't say it better than what Dr. Escott and the director said already. I'm obviously not a medical professional. I will say though, we know in our community that this summer we want to be able to barbecue. We want to be able to get to see our family. We want to be able to experience our friends. We want to be able to travel. If we want to get back there, we have to get vaccinated. And that is the word that we need to be spreading. That enough of our, I will say enough of my family members and folks in the community and network that I have gotten vaccinated. I took the J&J shot about 2.5-3 weeks ago, and it was a huge relief off my shoulder that I wasn't going to be making my grandmother ill when I go visit her, or that my aunts or other seniors in my family wouldn't be impacted by me. And that's how we need to be thinking about this. So for the brothers who are on the line, who are in your 20s and 30s and 40s, you have to know that the decision you make in spreading the word to the community that you support really matters here, because we are truly protecting the lives of our seniors. So really appreciate this forum. Every time I get an opportunity to do this, I do, because it's so important that within our community we are spreading the word. So thank you, brothers, for hosting.
And thank you all again for taking your time out your evening to spread this important information. Brother President Flournoy, I'll go ahead and head it back to you in your hands.
Listen, I just wanted to thank everybody again on behalf of the Gamma Eta Lambda chapter of Alpha Phi Fraternity Incorporated, here located in the great city of Austin, Texas. We want to thank all of you for participating with us this evening. I don't know all of you personally. I know Brother Shorter personally, but Director Hayden Howard and Dr. Escott, I just again want to thank you for participating. This is major in our community, and anything that we can do to get this information out, we want to do it. So thank you for your time this evening, and we look forward to connecting with you again soon, because based on some of the information in the chat, I think we're going to have to try to have y'all all back again to continue to spread this word out. So again, thank y'all so much for participating this evening.
Happy to be here anytime.
Thank
Likewise.
you.
Thank you so much.
Brother Deshay, I'll just leave it back into your hands. We can move forward in bringing on the next three panelists at this time. So you can go ahead and introduce them, and I will get them brought on to the live stream.
Indeed. Thank you, Brother President. And so our next three guests for tonight's evening town hall will be pediatrician with the Austin Regional Clinic, Anna Liz Holloman, Dr. Anna Liz Holloman, as well as this next gentleman. He's a surgeon, he's a virologist, and recently Chief Medical and Science Officer with SRS Incorporated, Dr. Lane Rowling, as well as the Assistant Dean of Diversity and Inclusion with the College of Pharmacy at the University of Texas at Austin, Dr. Skylar Walks. Thank you all for your time this evening. How are you doing?
Super fan. I've listened to these folks talk. I want to talk now. Sit back, listen to these guys.
Well, definitely. Let's go ahead and jump into it. I'll start with Dr. Holloman.
They get Titanic in a minute because they're way out of their lane.
So recently, Pfizer, the biotech, announced on Wednesday, March 31st, they had some trials, and the participants were aged from 12 to 15 years old. And they're saying that their new vaccine demonstrated a 100% efficacy rate, which has a robust antibody response. My question to you is, when should vaccinations be available for people under 18 years old?
So right now we have vaccines available for kids 16 and older with the Pfizer vaccine. So Pfizer vaccine is already available for kids 16 years to 18 years of age. And there's studies being done right now with Moderna, and they're even testing down to 6 months of age. So they just opened those studies within the last month, and they are having a phase 1, 2, and 3 ongoing clinical trials for babies. And I think that's just great because for the most part, kids don't have a lot of transmission. They're getting it from their adult family members, but there is some transmission. And not only to have them to not be able to transmit it, but to have them protected is great, because we do see MIS-C disease in kids that's rare, but still occurs. And if we could prevent that as part of this COVID-19 disease, that would be great.
In your line of study, have you came across any children with COVID-19 within that margin of age?
Absolutely, absolutely. Like I said, not a whole lot of transmission during in the classroom or in the daycares. About 95% of my patients that have had COVID, we can trace it to an adult family member that they've got it from, either the parents, the grandparents, a child care provider that's given it to them. So yes, and it's not fun for the parents to have it and then having to take care of sick kids at the same time.
Dr. Rowling, question for you. And so now that some of us have been vaccinated, we've received our second shots. Now there's new information saying, oh, in a couple months we will be in need of getting a booster or a follow-up shots. Why is there a need for boosters? Please explain this to us.
Thank you very much, folks, for having me on this platform. This keeps stuff real, based off of immunology, medicine, and science, and about people's feel goods and stuff. The reality is that these vaccines, Pfizer, Moderna, J&J, J&J is having significant complications with people getting clots. And, here in Nevada, Las Vegas, a girl's having her third surgery to get the clot out of her brain. These vaccines themselves, period, you will be getting a booster shot 2 or 3 times a year for the next 50 years. That's a fact. And the reason why is that there's no such thing as conferred immunity or affinity maturation with any coronavirus, period. You can read any clinical immunology book. And the reality is that each of these vaccines, for example, everybody's Pfizer's vaccine, folks, is based off of D614 from last year. Somebody was sick, they got the sample, made a vaccine, E. coli, et cetera, made a vaccine, and that's what they're in everybody with. That vaccine had no vaccine effectiveness against the South strain, the Brazil strain, definitely not the Indian double mutation strain, the London strain. So this is the problem that we've had, because we've had folks get into the lane that really don't understand the medicine and science. And then the reality is that that's why it usually takes 3 to 10 years for you to come up with a vaccine. So in reality, you can get vaccinated today from Johnson & Johnson, Moderna, and Pfizer. And I promise you, go and take your mask off and breathe the air from Brazil or India. I promise you, you're going to be in a body bag. That's just a fact. Because these vaccines, each vaccine has to be made for the individual variant. That's just the reality. And also, folks, if you are going to have an effective vaccine program, the most important and simple thing you have to have is a rapid antibody test. And that rapid antibody test has to be done at the beginning. Hey, Dr. Rowland, you're going to get a shot. Okay, get my rapid antibody test paid by Pfizer. And it says, Dr. Rowland, you have no antibodies. Or, Dr. Rowland, you've been exposed. I get my vaccine, I get my first second booster. Well, on a day 30, I better be getting another rapid antibody test to see if I elicit any neutralizing antibodies. And if the test does not show you have antibodies, then the vaccine is effective. It's not effective. So everybody should be getting rapid antibody 0 day, 3 months, 6 months, 9 months, 12 months to effectively measure if the vaccines are doing what they're doing for creating herd immunity, decrease hospitalization, infection, natural infection. That is the reality of the vaccine program.
Okay, thank you for the information. You were breaking up a little bit there, Dr. Rowland, but I think we received most of the information as far as what you're describing in regards to the question I posed. Dr. Waltz, is there a mental effect to be concerned with about COVID-19 and the social isolation? How does the Black community deal with this?
Well, I think first of all, I'd like to apologize for my lighting. I'm going to make sure I adjust that in a little bit. But
we can see you perfectly fine.
I'm definitely happy to be here, and I feel illuminated by all of the energy and wisdom in the space. I want to first begin by saying Black folks are not monolithic, right? So even though we're doing our best to absolutely gauge best practices and state generalizations as appropriate, we're not monolithic. And so as a consequence, when you're talking about mental health and the compounded effects around mental health, you're going to have that show up in folks differently as a consequence of social isolation, right? There are certainly some cultural norms that have been changed and we've had to adjust. And obviously that would impact feelings around isolation, community, a sense of affinity, and having, quite frankly, endured the pandemic in the midst of one of the most intensely widespread in terms of day-to-day realities around racial injustice and state-sanctioned police violence has absolutely, I definitely believe, compounded the sense of isolation, mental health challenges, and overall wellness that we're experiencing as a community. Oftentimes, Black folk and communities of color, Black, Indigenous, and people of color communities can find restoration in affinity spaces, right? Whether that be in our faith-based community spaces, whether that be in our organizational spaces. And that's had to adjust quite a bit through Zoom or other web-based interfaces. So we're not able to engage with our loved ones. Many of us have had to bury our loved ones from a distance. We're attending memorial services online. We're not physically able to say goodbye. And certainly that also has an emotional impact. I know that's impacted my family personally and several of our friends and loved ones, where not being able to have a proper or traditional goodbye or even the cultural repast, which many of us can relate to, impacts a sense of community and a sense of coping mechanisms for grief. So I think it looks differently. I'd also lastly like to say here, with our K-12 learners, our younger learners who are in their formative years of development, social interaction and engagement is such a huge part of their development. And having that shift, right, to a predominantly online experience has also, again, research is burgeoning here. It's coming out every day. We still are looking at what studies are producing. But we do know that that has also impacted a sense of wellness and mental health well-being for a lot of our younger learners as well. And this is not anything that's not also impacting our post-secondary learners. We hear that from our students at UT Austin and the College of Pharmacy as well. They can't wait to get back into interpersonal engagement with learning, but they are also prioritizing what is the most effective in being safe and preventative in spreading the disease or the virus, excuse me.
Thank you very much. Dr. Holland, there's a lot of myths out there, especially within our community. One of those is that it was rushed. You know, there was a lot of data that was captured with people of color, or a myth that, in your, well, particular to you, kids can't spread the virus. Do you mind tackling some of these myths that we hear a lot within our community?
Okay, and I did not get a chance to say thank you guys for inviting me on. I love speaking at these type of engagements to be able to just kind of give information on what I'm seeing and try to help everybody to deal with these issues that they're dealing with and help folks get vaccinated or choose to get vaccinated. So that's actually one of the things that I hear from my patients is they're concerned, they're scared, and I think the African American community has a right to be scared. There's been a history of untruthfulness and a history of not doing right by Black people. And so we have that history of, and that discomfort of, should I trust the government? Should I trust something that was rushed? Should I trust something that has never been given before for a disease process that's never been had? But we always have to fall back to the science. And no, we don't have long-term studies of these mRNA vaccines, but we do see COVID affecting us every day and killing us, disproportionately and in large numbers. So with anything, with taking aspirin, with taking Motrin, you always have to weigh risk and benefits of what's better, what's going to be most beneficial for me to survive in this pandemic. So as Dr. Walks stated earlier, it's not only the physical part we have to survive, it's the mental part that we have to survive as well. So being in the environment of having people to come and talk to me. So right now I can't really offer or recommend the vaccine for kids because it hasn't been, approved yet, but I can recommend it for the adults since we know that that's the most common way that the kids are getting it. And again, to just be clear, it's not that kids cannot transmit it. It's that they have a lower rate of transmission from what we're seeing versus adults. So we still have to be careful. And when the FDA says that, the studies have been done and everybody can look through it and go through the information, and if the risk or the benefit outweigh the risk, then at that time I'll be able to recommend it for my younger kids. But those 16 and above, right now, I'm definitely recommending the vaccine for them.
Thank you. Thank you very much. Dr. Rowling, we hear these terminologies all the time, variances, efficacy rates, and etc. Yesterday, Texas A&M University researchers, they identified a new COVID-19 variant called BV1, which was, in a sense, named after the Brazos Valley. And supposedly it's resistant to antibodies. Does this new discovery and other variances defeat the purpose of getting vaccinated? These are some of the things that people are thinking about. Why should I get vaccinated if there's other things that are coming out of the woods or weeds, if I should say? Why should I get vaccinated?
Well, I think your premise is the opposite. I think people are pushing back on people, and they're not basing it on real medicine and science. For example, you look at the Pfizer paper, the people they did in Germany all white, 18 above, antibodies last. We can get into the science. When we start talking about really having a vaccine program, your vaccine program has to be what we call have vaccine effectiveness. People get on here and start talking about things got 90% vaccine efficacy. That doesn't mean anything in the real world, because you have to take that vaccine, then you got to inject Black folks that have sickle cell. You got to inject Black babies that have autism, Chinese people that have high blood pressure. And I promise you that 100%, 90% vaccine efficacy is going to go down to 15 to 20%. Then we start talking about now the new SARS virus itself, the variants. There are over 4,000 of them. The virus mutates every 2 weeks. Now we're getting double mutations, significant mutations in the spike protein. Folks, I'm sorry. I don't want to be the person on here telling people, giving people bad news, but I'm giving you reality so you can survive. Each of these vaccines have to be made to the particular virus that's in the community. For example, you're going to do a vaccine for the Brazil P1 strain or the mutation strain, you have to make a brand new vaccine to be able to have the potential to be able to have some type of vaccine. What we're looking for, the word is vaccine effectiveness in the real world. That's what you have to do. But as long as we continue to have mutations, the virus is mutating every 2 weeks. We're having people that have the virus in chronic immune patients that have HIV, people that are on immunosuppressive drug. The virus is changing. This virus is going to change to be able to live. And so in the reality, when you start talking about having vaccine effectiveness for the Black community, you better sit down and go to Big Mama in the Mississippi Delta and explain what the SARS virus is. It's the largest SARS. It's the largest RNA virus on the planet. Very immunogenic. Been around for millions of years. Came from a bat, etc. When you do that and explain that, community education, also you explain to them what the vaccine is. What are vaccines made for? I'm a pro-vaccine person. I've injected thousands of people in the jungles of Peru. I've seen babies die from tetanus. I've seen babies die from diphtheria. I'm a pro-vaccine person, but my information is based off of medicine and reality. So this is what Black folks need to think about, and you're absolutely right. Is there a mental health part of it? Absolutely. We all have some type of post-traumatic syndrome or been infected with the virus in one part of the world. Know somebody's been infected in the world, or somebody's died from the world, because I get called all the time. Today, I was on a television program an hour ago. 2-year-old baby got COVID. Well, guess what? Babies get COVID. And in Denmark, 25-30% of the people that are transmitting the diseases are children that are asymptomatic. Children can be symptomatic because of the exposure of coronavirus itself. So when we start talking about variants is going to be part of the new norm for the next 50 years unless we get a hold of an effective program, education, masking. Better know how the virus is transmitted, not just by respiratory, it's also secretions and also by feces. You understand that? You're putting biosafety, biosecurity protocols with a very effective vaccine, then you can get a hold of the diseases, the virus.
Thank you, Dr. Rowley. Dr. Walks, continue on with the discussion. If we are so marginalized, the black community and populations, and so since we are so unequally impacted by other groups, demographic groups, the question would be, why aren't they being given to those who are impacted first, or why weren't they given to those groups first, or included within the groups such as the elderly?
That's a brilliant question. And so before I answer it, I'm going to connect the dots to your previous question to me around mental health. Something that I think begs to be articulated in this space is there's also been a surge in overdoses with respect to opioids, right? Many of us have lived long enough to remember when this was something that was thought to be very central in urban Black communities. And it was not identified as a health crisis. It was largely identified as a crime issue, okay? I will also say that in this surge of opioid overdoses, largely disproportionately impacted by or as a consequence of fentanyl, it was largely rural and suburban white folks that were impacted. Within the last year, data has shown that African American folks have now disproportionately made up a large number of those overdoses. So when we talk about the compound effects of mental health, isolation, increase in high-risk behavior, what that looks like, the data happens or is revealed to us after the lived reality and effect, okay? So I don't disagree with Dr. Rowling around science and medicine. In addition to that, I also believe that our cultures, our communities have stories that are told, and sometimes the data comes after the lived reality demonstrates a lot of times what those needs are and the need for interventions and supports are. So when we talk about who got the vaccines first, who's still getting access to the vaccines, who's still making up the majority of folks who are getting vaccinated in terms of data, we know, and I'm speaking specifically about the state of Texas, Roughly 41% of individuals vaccinated identify as white. A little under 7%, I think it's 6.84%, identify as Black or African American. But stay with me now. We also know that on April 8th, the director of the CDC, for the first time, acknowledged that racism is officially a public health crisis. I think everybody on this call knew that long ago. We've been combating and confronting systemic issues, structural issues that have already betrayed the fact that there is access to certain interventions that would improve health outcomes that are not made available to communities of color. Most specifically, intentionally not made available to communities of color. There are different systemic barriers that inhibit access. We know that. And this is one of those instances where I say the data was late in catching up with a lot of our lived experiences and realities, right? And so I appreciate the fact that in no way am I making light of Dr. Rochelle Walensky's proclamation that racism is in fact a public health crisis. But I think we have gone centuries in knowing that that was the case. And we have to do our due diligence to build or rebuild trust in the African American community. We have to do our due diligence in not only stating proclamations such as that are powerful indeed, but also dealing, quite frankly, in the business of truth and reconciliation and admitting that there have been structural designs that have intentionally inhibited access to some of our most vulnerable communities. And that has certainly contributed to the lack of trust and access that we've had to change the outcome of our health outcomes. And we've continued to have negative impacts on with respect to our social determinants of health because we've not had access to those things. So for those who thought, and again, I don't want to be political here, but I'm always going to be very authentic. For those who thought that we had somehow crossed a threshold into a post-racial society with 2008, I think have had a rude awakening that for the rest of the world, and most specifically, a lot of clinicians and practitioners in healthcare and the healthcare sciences, what the COVID-19 virus has only done is reveal what most of us have lived and known generationally for centuries, is that racism, not so much the virus, but racism and all the inequities that it promotes and advances is largely responsible for the morbidity and mortality rate that African Americans are facing and still impacting our access to the vaccines.
Your thoughts, Dr. Holloman. This following up with thank you very much. You just blew my mind there. But going further, how can we describe the safe bio protocols? What should we be doing in the Black community to decrease transmission of COVID-19?
I'm sorry, can you repeat that question again?
Sure. My question is, what biosafe protocols should the Black community be implementing when they go to the grocery store or in their own household? Excuse me. What are some things that we should be doing as a Black community to protect ourselves, if I would?
Absolutely. So masking, we know masking works. So this year was the record low occurrence of influenza virus. So typically I have over 500 cases of influenza every winter. This year I had one. So that means masking works at preventing transmission. Maybe not as well as COVID because COVID is much more contagious, but we know that it works if you're keeping your mask on. So for 9 months, almost a year into COVID, I'm as a pediatrician looking into someone's mouth. As kids are still getting, colds and allergies, so I have to be in their face with no vaccine. I managed to stay COVID free by masking, by washing my hands throughout the day, by distancing when I could distance, by not being in groups of people. So that's the things that are pretty much easy that our grandparents have told us for years. Wash your hands. Stay away, from groups. If people are sick, stay away from that. So I think if we do some of those common things we know to keep us safe and just not let our guard down. So even with vaccine, I'm not visiting large people. I still haven't visited my mother yet. So I want her to be vaccinated before I go visit her and not put her at risk. Because that's when, COVID first hit. My first concern was not getting it myself. It was getting it and giving it to my husband and giving it to my kids. So we have to protect those that are more vulnerable around us right now by continuing to mask, to distance, to vaccinate until we can get these community rates down.
Okay, what are some suggestions for K through 12? You hear a lot, that COVID-19 has been transmitted from kids. As we mentioned, we all are on the same page in that regard. So, what are some things that K through 12 can do as they are going into schools, not virtual learning, but actually in the classroom, not only just for them, their own colleagues, students, but also for the teachers? What are some things that can be implemented in that environment?
So again, we know masking works. So teachers being masked, the kids being masked when they're available to get the vaccine. So 16 and older. So we know that about half of the high school kids will be able to be vaccinated and protected. If we get the teachers to be vaccinated, again, that's going to decrease the rate of them getting it, them transmitting it, having some distancing going on. Washing hands throughout the day, doing the wipe downs, although there are some recent studies that show it's not so much transmission from contact, it's more respiratory droplets of how it's spread. So if we can do those same things that we know works in the community, in the school, and again, the schools have had notoriously much lower rates than community has had as far as transmission goes. So the ones that have been in school now, they've been doing a pretty good job of it. Pretty much when we're seeing the kids transmission is when they're in contact sports like football and basketball and they're not masking. So masking seems to be the number one thing that protects. But again, as long as we can get those who can be vaccinated and doing the distancing and washing hands, that should help the kids in school, as some studies have shown already.
Definitely. And I think the myth that's out there is that, if I've had COVID-19, I don't need to be vaccinated. But the thing is that we should be getting vaccinated. That's exactly what you're saying.
Absolutely.
Definitely. Dr. Rowling, there's some other myths out there. I just want to put them out there and within the forum here that we have. There's something that's talking about masking are safe. I know you know about our Texas governor, which has removed the mandate to wear a mask, even though here in Austin, we know the importance of wearing a mask. In addition, can we achieve herd immunity by letting the virus just spread into the community and not getting vaccinated? What is your thoughts in that regard?
Well, let's talk about masks. Well, I'm only 1% of the people on the planet certified in chemical and biological warfare by the U.S. Army. So I know everything about masks, from nerve gas, mustard gas, Ebola, etc. And I'm also a surgeon. And I've dealt with patients with HIV, with multi-drug resistant tuberculosis. So I understand masks. Masks is a definite frontline defense. If anybody ever tells you that, they're an idiot. And that's the reality. And that's one of the reasons why the virus has really got out of control here in the United States, because you have these people talking about their constitutional right to not wear a mask. Well, in medicine, if you're tuberculosis positive and you don't take your medication, put you in jail, and we'll watch you take your medication for 6 months. You have a constitutional right not to be infected by another individual. The mask is part of that front line. I think the big picture here, folks, is that we have to have a unified message that's consistent and stuff, and where we're going into the future. Folks on here, you have folks on here talking about vaccines, but there's no long-term science of medicine that shows that there is antibodies being produced 6 months from now. So everybody is taking a chance. But if you go back down to the basic biosafety security protocols, folks, i.e., wear a mask. Get you the best mask you can have. Folks, you have to understand that the virus lives in feces for 35 days. It's probably the biggest transmitter of the disease in India. But when you think about our society, you go out in our society, you guys touch the touch screens, you guys touch kiosks, all these public places, at the kiosks at the airport, they're infected with, they have feces on them, period, 24 hours a day. 1 billion viruses per gram. You can imagine going to the Austin airport or the Dallas airport, people in there taking dumps, they flush the toilet, the feces becomes down to 0.1 micron, goes all over the place. It's on the bottom of your shoes. Common sense stuff you have to continue to do. Even though you get a vaccine, folks, people have gotten a vaccine and people have died. I mean, from being infected from another virus, people have gotten a vaccine, they have died. People have had adverse effects from the vaccine, from Bell's palsy to, Guillain-Barré syndrome. And we have another effect now that we already knew that with it's kind of what we have with dengue, antibody enhancement. What happens is you get injected with the vaccine, your body produces antibodies and platelets. You got a clot formation. Even for all this information, folks, the vaccine, biosafety, biosecurity protocols, at the end of the day, it's going to come down to having confidence in the system, confidence in the people that are telling you what's going to happen, how it's going to be happening. And you better have people that are telling you how to survive, that have real life experience, in understanding how disease, especially viruses, are transmitted. Because this thing's not going to go away. This is going to be around for the next 50 years, period, in a story. The virus is not going to go away next week. You're not going to stick your head in a microwave or drink Clorox, and you're going to make this virus go away. That's not going to. And particularly for the Black community, and I'll end it on this, that we have to have more faith in the system. We can talk about the Tuskegee syphilis. We can talk about Dr. Sims, who was cutting out females' vaginals in Alabama without anesthesia, and he was a hero. My sister's a chief-old being in Dallas. I understand women's problems because my sister tells me about what Black women go through on a regular basis. Once we come back and we have an effective community education program, we sit down with Big Mama and we tell Big Mama this is a virus. Big Mama, you're going to have to get a test. I'm not going to take Dr. Rowland's word because I go down to vaccination. Do I create antibodies that protect us? And to get to that famous word that you like to use, herd immunity. Well, herd immunity, folks, out there, and I've said this for a year, MSNBC, you name it. Herd immunity is 90% of the population has to be infected by the virus, have antibodies from the virus or from a vaccine program. For you to get to that herd immunity, folks, this is reality. 324 million Americans have to be infected on the average. Well, that means 10 million Americans are going to die to that number. So it's a trade-off with herd immunity. That is why you have these shutdown of economy, shutdown of schools, hospitals, because you're trying to slow the virus down. But the virus is going to do what it do, period. You cannot put this virus back into the genie's bottle. This is a reality. And so, folks, if you're out there, you're listening, base your decision on vaccines, effective treatment like medication, the only FDA drug approving program for Black folks that get the COVID-19 test positive and you take the medication within 72 hours can keep you from progressing down the road. Listen, make sure you're following the science and the medicine and not what people feel good, because once you get injected with that vaccine, whatever, and you get a complication, you die, who's going to be responsible for that? So make sure you make your decision based on that. And herd immunity, we're going to be a long time from getting that because we have too many viruses out there right now. Thank you very much, folks.
Thank you, Dr. Rowland. I'm going to close this forum with Dr. Walks. My question to you, coming from your expertise in the College of Pharmacy, how can I phrase this question? What should we be doing as far as the Black community, as we head into the summer? What should we do? And as far as the effects of what's been going on since the COVID-19 hit the United States, what type of impact mentally does that have on African Americans?
Brother Charles, could you ask that one more time? I'm sorry, I didn't catch all of it.
Sure. I may be breaking up on my side and having technical difficulties. My question to you is, as we head into the summer, what things can we do, the Black community, as we're going to want to barbecue and et cetera, et cetera. What can we do to prepare for that? And as we are preparing for those events, what type of mental impact has the COVID-19 pandemic had on the psyche of the Black community?
Got it. Thank you for that. Well, first and foremost, I don't know if everyone is aware, but I think it bears repeating. Today, folks, is an important day because it is Mr. Luther Vandross's birthday. He would have turned 70 today. And I say that because as probably one of his biggest fans, I know I'm not the only one, I am sentimental about the fact that I won't be listening to Maze and Luther's greatest hits and a little bit of Anita and a little bit of whatever shuffle we are going to do at the barbecue this summer. And it's okay. It's okay to grieve those things. I want to make sure that I underscore that because I also think that there is great harm in normalizing the trauma that we're experiencing collectively, right? It's okay to grieve those things. But it's not okay to say because I'm sick and tired of being shut in or I'm sick and tired of social distancing, and even though I'm vaccinated, because I've heard this a lot, I'm vaccinated so I can live life like I lived it pre-pandemic. Those are dangerous behaviors. Those are high-risk behaviors that are not going to help us advance towards getting this virus under control. So I would recommend, much like Dr. Holloman already shared, mask. Get creative if you need to. Throw some appliques on there. Bedazzle. Yes, bring the bedazzle back from the late 80s and make it cool again. I would say have parties. I don't know how many of you, it sounds corny maybe, but I don't know how many of you have experienced a Zoom or virtual birthday party, anniversary party, celebration of sorts. It's a way to bring folks together. And as Dr. Rowland said, we can make sure Big Mama or Auntie or Uncle or whomever can participate too. Just give them the resources and tutorials in advance. But I would strongly encourage us to not get complacent with the little progress that we're making to believe that we can return to the way that things were. We're not there yet. That's not where we are. And quite frankly, I don't know if we'll be there for a very, 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 very long time. So we have to get creative. And we are a beautifully creative people, I never thought I would ever spend time on TikTok or whatever it's called. TikTok. Thank you. Got tongue-tied there. TikTok. But I am rolling. I have fallen in love with different forms of entertainment and different ways to connect with people. And so I think we have to be creative in finding the ways to connect with people, meet people, engage with our loved ones, make sure that we are not forgetting our elderly folks who may not have the same levels of access to technology that we often take for granted. We also have to make sure that we, quite frankly, advocate for ourselves. If we are privileged to work from home, that doesn't mean that we're working less. And we need to make sure that we also rail against that stereotype and trope that we are somehow being lazy or somehow using that as a scapegoat to not do work. So I think those are the things we need to do. Connect with community, connect with your D9 folks, all of that stuff. Connect with your faith-based community. Connect with your neighbors from a distance. I'm a little extra. I don't even let people touch my dog, because we know the animals can actually be carriers of COVID. So even if they want to pet my dog, I don't allow that, right? So I think we just have to be mindful of being creative, finding different ways to celebrate, make a Luther playlist. I know I did this morning. And find other ways to engage so that we are attending to our wellness and our mental health, but at the same time, we're not sacrificing what we need to do to be safe. Mask, wash your hands, and social distance.
Thank you all again for your time this evening. Brother President Flournoy, I hand it back to you.
So good evening again to everyone, all of our viewers, and thank all of you that have participated, Dr. Walks, Dr. Rowling, and Dr. Holloman. Fun fact, Dr. Holloman, we've been knowing each other for about 12 years since my daughter was born. So I absolutely love her and how she's taken care of my children and grown them up. And I've also been happy to get to know Dr. Walks via email back and forth and conversing. And Dr. Rowling, I hope to get to know you even a little bit better after this session. I just again want to thank y'all on behalf of the Gamma Eta Lambda chapter of Alpha Phi Alpha Fraternity Incorporated. We want to thank you so much for y'all's participation in this event tonight. Our desire is just to push information out to individuals that don't have it. And so we utilize our platform as a fraternity to hopefully bring other individuals in that might not have any of this information, might not have access to individuals like yourselves and scholars like yourselves that can help people along the way. So I just want to thank y'all again for your time this evening. We're about 5 minutes over, but that's okay. I just wanted to definitely come back on and publicly thank y'all and look forward to reaching out to y'all again soon, possibly as we continue to try to push this information out. So I definitely agree that COVID is not going anywhere. It's not going anywhere. And so we need to continue to help individuals learn the things that they need to know so they can be safe and better protect their family and loved ones. And so at this time, I bid y'all good evening and thank y'all again for your time. And absolutely, y'all have a great, great night.
Bye-bye.
To those that are still viewing with us, we thank you so much for being with us this evening. I ask that you might come back and join us next week for the second aspect or the second segment of the virtual town hall. We're looking forward to having additional individuals on, additional scholars that can help, again, pass out this great information to each and every one of you. You know, at this point, we're about to sign off. I'm going to ask Brother Deshay if he wants to have any parting words, and then we'll actually show the media for next week, so that way you can see the individuals that will be sharing with us next week. So Brother Deshay.
Again, thank you for joining us this forum. I think it's definitely needed in this point in time as we explore the COVID-19 in the Black community. As mentioned, you heard a lot of information from scholarly guests, which are very well known and very knowledgeable in their respective careers and their. And so I just want to thank you again. Definitely tune in for our second segment. We're going to be talking about education and COVID-19 within our community.
Absolutely. So those of you that are on with us, thank you so much for joining us this evening. If you would, if you're on social media, please share this event. We want as much information to go out to as many people as possible. To the brothers of Alpha Phi Alpha Fraternity Incorporated, Gamma Eta Lambda chapter, thank you so much for your support. Thank you for sharing this event. And we look forward to having y'all back again next week. As me and Brother Deshay sign off, we're going to show you our media for next week, so that way you're aware of who will be with us. Y'all have a great, great evening, and thank you so much. Actually, even though you can't see me, I want to again name off the individuals for next week. We look forward to having Dr. Tingle, Dr. Eric Tingle next week with us. We look forward to having Dr. Anthony Mays with us with the city, he is with Austin Independent School District, he's a chief of schools with Austin Independent School District. We also look forward to having Brother Tony Hansen with us next week. He's on the board of trustees for Pflugerville ISD. We look forward to having Alexandra Grant with us, who's a school counselor in the Richardson ISD. We're looking forward to also having Ms. Sheila Lewis with us next week. He's an elementary school assistant principal with the Cy-Fair ISD. And then lastly, Ms. Sheila Reed, who is a high school principal in Pflugerville ISD. So again, we thank each and every one of you for participating with us tonight and look forward to having you back again with us on next week. We're signing off now, and we'll see you next week.